be able to provide these services to our community, offering it at a fair cash price, which is a win-win for both, right? So it's a win for the community because you're offering a service more quickly than the healthcare system can allot for. Maybe it takes months for you to get in for one of these tests at a standard healthcare loop, where we can provide it the same week most of the time. A win for us because we're getting reimbursement at a higher level. A win for the patient because they're getting it at a lesser level than they would pay typically if they were to have to pay full price somewhere. So again, it's a win-win scenario that we're trying to build our cash program on, which is part of the NeuFit journey for us as well.
I'm Garrett Salpeter, and I believe that the most powerful and transformative way to help people recover from pain and injury, heal from trauma, and reach their highest levels of fitness and performance is to focus on the nervous system. In this podcast, we'll share knowledge from the frontiers of neuroscience and inspirational stories of how applying that knowledge has empowered people from all walks of life to heal, adapt, and grow. Hello, NeuFit Nation, and welcome back to the Undercurrent podcast. In this episode, we have not one, not two, but three physical therapists from NCEPT, Physical Therapy Clinic in Escondido, California, down in the San Diego area. And Skye Grayson is the owner of the practice. Malachi Votaw joining us is the clinic director, and Julia Whitehead is the clinic manager. And I'm really excited to have all three of them on and feature their practice because of the way that they've integrated diagnostics into their practice with both, EMG and nerve conduction studies and musculoskeletal ultrasound, and then how they've worked the Neubie in during that. I think they have a very cool practice model. Having gotten to connect with them at various events recently, I think they have a wonderful clinical perspective, and they're doing great work. So I think listening to them describe their practice and their frameworks and the work that they do is going to give us, certainly some inspiration, some ideas, and I'm excited to dive in and hear more from them. So Skye, Malachi, and Julia, welcome.
Well, thank you.
Thank you.
Yes.
Glad to be here.
So if you're just listening to this and not seeing it, it looks like all three of them have similar backgrounds because they're in the same room. So three screens sharing one microphone. I think we got it figured out.
Yep.
So I would love for you, all three of you, to be able to introduce yourselves to the listeners. So Skye, can we start with you? Can you tell us how you came to be a practice owner yourself?
Yeah, absolutely. So I've been a clinician since 2002 here at NCEPT. Started off as a staff physical therapist. We try not to use the word staff if we don't have to, but as a team member here since 2002. And then as I practiced, there was three owners, and as they started to retire and look at transitioning to getting out of the game, I kind of had to make a decision if I wanted to be an owner or continue on the path I was going. And so I decided to buy out one of the partners and practice with two other partners for a good 5-6 years at least before they retired, and I bought them out. But for me, it was really a big shift mentally from going from an old clinical model more based on owners to shifting the NCEPT team to more of a team-based model, which is what we're continuing to try to develop and dial in. And I think having some success doing that over the last few years.
And that's another one of the reasons that I'm excited to have you on here, sharing your practice model and philosophy and frameworks. And so we'll dive back into that momentarily. But first, Malachi, can you introduce yourself also, please?
Yeah, so I've been at NCEPT for 4.5 years, or almost 5 years now. Coming right out of school, this was my first job I got to find, and I was fortunate to find this location. I was actually an intern here before school, and I loved the culture, so I came back and having no idea that diagnostics was going to be a part of my journey. Honestly, didn't even know that PTs could do ultrasounds or nerve studies. And when I found Skye and jumped on the team and got going, we discussed the opportunity, and I was full ahead from there and ready to jump in, and got started with ultrasound, I think about a year in. or so, 9 months or a year, I can't remember exactly. And then another 6 months after that or so started the nerve study training. And so I've been very fortunate to have this additional advanced testing as part of my personal practice model. And then a couple of years after that, having the NeuFit on our team, and being able to have that being a direct application as well, especially on the nerve study side of things. And so I think Julie and I may have a bit of a different perspective as from Skye. He's practiced 20 years or more maybe 15 years or so without some of the extra services that we have now, the diagnostic testing and the NeuFit. Whereas Julie and I have been able to really start our careers with that. So my mind instantly goes to how can I utilize these extra tools? And I can definitely say that might be an advantage I've found compared to some colleagues that I've worked with and spoken to and just kind of picked their brains on. So lucky to be where I'm at and happy to be here.
Awesome. And finally, Julia.
Yeah, I've been here as a treating clinician for about 2 years. This is my hometown, so I get to see kind of that unique perspective, treating a lot of family members and friends. But part of my journey, I actually was a patient of Skye's. It's probably like 6-7 years ago now. Then I transitioned as a tech in college, getting those hours, and then now a clinician here. So I've kind of made the home circle back here. And so out of school, I knew this is where I wanted to be. Just again, like Malachi said, that culture is something we love to continue to uphold here. But yeah, like he said as well, just I've always gotten to implement diagnostics, so I don't know better. I had those years as a student, but yeah, it's a distinct change that we love to show those students that come through our pipeline here to just the benefits that we get to apply and then expose them to the NeuFit too. I think most of them have no exposure there, so it's great to start spreading the word that way too. But yeah, I think it was about 6 months in that I, as a clinician here, where we started talking about Neubie and just learning about it, had that demo, and then the rest is history. And as we continue to learn how to use it better and help more people.
Awesome. I love that. And one thing that I think is worth pulling out there, we often hear in the industry these days how difficult it is for owners to find therapists to hire, and how difficult that dynamic can be, and to be able to have interns, techs, students who you get to know and connect with, and the fact that you came back there, tells me that Skye had done a good job of establishing that culture, which you even referenced, Julia, and that you felt drawn to come back there, and also that's a great recruiting pipeline too. So I just I think it's worth mentioning that. Before we get into some of the brass tacks of diagnostics, Skye, you said a couple of very interesting things there. You said you don't like to use the word quote unquote staff, and you talk about this team philosophy. Can you tell us a little more about your framework there for how you think about this team driven as opposed to owner driven dynamic?
Yeah, I can give it my best shot. So again, being in practice for 24 years, and when I came out of school, I think a lot of private practice was still very owner driven. I mean, I know there was big clinics, but I got to see how it created some confusion in the team, being a team member myself. And so I think we've taken some leadership training, and they kind of broke down the difference between staff and team. And that just latched onto me. We're all team members. And I know something I've done even since I was in grad school is try to surround myself with people that I saw as smarter than myself, right? Or strong in areas that maybe I'm not strong in. My strengths complement their weaknesses, that kind of thing. And so I think that any success I've had is really being intentional about that. And again, the journey we've been on over the last 10 to 15 years in what I would call a relatively hostile healthcare climate is, again, I'm not going to think of everything, and recognizing that no one person can solve all the problems. So then empowering people to really be the problem solvers, because together we'll solve a lot more problems a lot quicker than relying on one person to do those things. And so again, you surround yourself with people like Malachi and Julia, well, we call her Jules, then again, the amount of blind sides you have. And I think even just in the context of NeuFit, it's a perfect example of how a team was able to integrate something new for this old dog relatively. I've been treating for 10, 15 years before I even knew what diagnostics was. Another couple of years after that, I learned about the NeuFit. But if it was just up to me, it would have never happened, because I was at capacity, at least mentally, and at that time. And so again, hearing Malachi and Jules' perspective years later, here we are with a multidisciplinary kind of approach to something that all of our patients face. And I feel like we're able to bring kind of the best efficacious care that we can because we have that team.
That's awesome. I think that's really well said. I want to pull on the thread of one of the things that you said there, which is that when you were a quote unquote staff PT in a more owner driven practice, you felt, I think you said created some confusion. You felt some confusion. Can you,
Yeah.
Can you describe a little more about that?
Yeah. So again, I think in practice, I mean, I'm speaking from my relative experience, but physicians, physical therapists, anyone that had their own practice was probably treating full time and then trying to do as much business as they can with the time they had left over. Right. Mm-hmm. And so again, I think that worked for a long time. I don't think the business of healthcare was so complicated, but as the business of healthcare has gotten more complicated, I mean, we measure so many things. I mean, behind Malachi and Jules, we have tons of graphs. Like, you're constantly tweaking the different variables that you can control to basically run a healthy business that allows it to grow and provide the resources that you need for both your team and your patients and your community, for that matter. So again, when it was just an owner-driven practice, it wasn't that the owners weren't doing a good job. It's just the business got more complicated, and that structure wasn't allowing for us to handle the problems we were facing. And so we had to start delegating, empowering, and we couldn't do that with an owner-based kind of hierarchy, So as the teams matured, I mean, Malachi and I were just talking about this. Some of the responsibilities that the owners used to do, we now have our lead tech do, as it comes to scheduling our techs and ordering supplies and all those things that used to kind of be done by the owner or the right-hand person. Now we're empowering a younger team to be even more business savvy than we are. So we like it.
Nice. So part of the confusion is what to focus on versus the business, compare the business versus treating. And then some of it is, I love the saying, delegate and elevate. You can delegate this thing so someone that you trust can handle it. And then you can elevate your focus to the next, highest task or wherever you as the owner or in whatever position one is in, should be focusing your time. So I really appreciate that perspective. And I think I'd like to ask you, Skye, one more question, and then we'll move on to Malachi to get a little bit more into the nuts and bolts of the diagnostics. But what that, you talk about, along your journey as a practice owner, you bought out these other partners, and then around that time you sort of discovered diagnostics, got interested, added that in. What inspired you to make the leap and add in the, was it ultrasound first? Was it nerve electrodiagnostics first, and what inspired you to make that change in your practice?
Yeah, I mean, I guess there's quite a bit I could unpack there. I mean, NCEPT, kind of the heritage I grew up with, is every clinician had a specialty, right? So you had something you focused on, your OCS, or I think at the time we have wound care, we have a pool, so there's aquatic therapy. Some focus in spine, some are more sports related. you're the shoulder guy, the knee guy. So again, always kind of having that. But I think that's more the norm now. Like you have to have those things just to be a successful clinician. But then also facing kind of, as I say, the healthcare challenges. I've always, it's just gotten more and more complicated with insurances. And, I don't want to get into an insurance talk necessarily, but the reality is the business behind the scenes, the things that have to happen for us to have a successful clinic from a reimbursement structure, and protecting your clinicians from that and giving them the space to be successful. Well, again, the game on the other side of that wall, the administrative burden has gotten pretty hard. And so then what can we do to elevate the care that we can provide to our community that allows us to improve the other side of the equation? So now that I'm coming at it from an owner's perspective, I believed in the value of the diagnostic. So again, an ultrasound, kind of your best special test. I can look at a shoulder, I can look at a knee, I can look at an Achilles. You can see those structures and see if they're compromised, yes or no, and I can do that relatively quickly with a lot of confidence. And then as we unpacked the electrophysiology or the nerve conduction studies and the EMG, again, I feel like that's where we really met NeuFit along that journey is, okay, first, why do we need to know this and how is it of value to the community? Oh yeah, there's this whole layer of the nervous system that impacts our pain, impacts our symptoms, and again, being able to objectively measure it and then affect change. And so that just seemed to make sense to me. And unfortunately for us, we were able to learn from other practices that are ahead of us in that, and seeing that, hey, physical therapists can do this. So now we're leveraging our license to our highest level, but then we're also helping our community by being more accessible to services that are just generally more difficult to get. Everything from the athlete on the sideline, high schoolers, or Malachi, I know, just did a college player that was home from an injury. And then Jules, I think, did the basketball coach who hurt his shoulder in the yard, trimming up his vineyard or whatever. So again, it's like, it's just a tool that allows us to get to the answer quicker and solve the problem faster.
That's awesome. So when you decided to bring in diagnostics, this is before Malachi joined the practice. Did you do both training in both ultrasound and electrodiagnostics?
It was crazy. I did it all at once. It was not the recommended path that I don't let our clinicians do. So we have them do the ultrasound first and then add the nerve conduction studies and EMG, because it's just a lot. I feel like the new grads absorb it much better than I did, because again, I'd been out of school for almost 20 years when I started that journey. So my brain had shrunk significantly, whereas theirs are still expanding and, able to absorb that material a lot better.
Well, I know I've said this the last time we were together, but I do want to acknowledge that. I think it's very true that the day we stop learning is the day we start dying. And, for you, having practiced for 20 years to put yourself out there, to expand in that way, to learn these new skills that, like you said, add value to the community and help the business and do, I just want to acknowledge that, because that's really wonderful. And it's a great role model for these team members of yours, these budding young leaders. Yeah. And, I think you really, really are leading by example. So I respect that a lot. And I think it's a good time to segue to Malachi. So Skye told us he had you train them sequentially rather than together because of what he went through there and lessons learned. Can you tell us, Malachi, about the experience there? Because it is like kind of like a fellowship. It's like getting another doctorate or getting another fellowship or specialization, or it's very in depth. So can you help everyone understand what the training was like in both the electrodiagnostics and MSK ultrasound?
Yeah, absolutely. So I think we gave me about a year, 9 months to a year, and before we started, me jumping in the training, and that was me kicking Skye in the shin every day, saying, "Hey, can I start now?" So finally got there. And because I'm excited to jump into anything new and fun, and I overwhelm myself for sure with that at times, but that's just kind of how I roll. And so starting with the ultrasound, that's the fellowship program. So the amount of time on in the coursework itself is not actually extremely extensive for the ultrasound, but the amount of time it takes to practice to get good at understanding the image and getting the image you need, that's the extensive part when it comes to ultrasound. And just time and time again, looking up other images or referring to your colleagues and or your mentor. And so you go through a full mentored process where you submit all of your studies, your first 150 studies and more, to whoever your assigned mentor is. And I'm actually a mentor for that process now. And that way you get the guided feedback consistently. And hey, you need to get this image better. This is what's going on in this image, and just getting that constant feedback. And so again, coursework there is actually fairly short, and then you just start practicing, and able to build that into your daily practice. And then you get interested in something, and you just kind of nerd out sometimes. And hey, I'm going to go look at this, or I'm going to go look at this, and take it home way too many times and try not to drop it. And then you finally know what you're doing. So that's a fun process. And that one I feel like really lines up with what PTs are already trained on the anatomy we have. And it makes sense. It still takes some time to be able to translate the anatomy from your cadaver lab and your textbooks to now a grayscale image, and looking at that grayscale image both in long axis and short axis, and being able to kind of create a 3D map in your mind in grayscale compared to what with your textbooks. And so that's really it's almost, I usually explain it as you're learning to speak another language with your eyes. And that's really what it takes, is just understanding that new language. And the more you do it, the better you are, as with anything. So reps matter. So partway through my training with ultrasound, jumped into the NERF study. So I hadn't finished the fellowship yet. Again, me kicking Skye in the leg every day saying, hey, let's start. Was able to jump into the electrodiagnostic side of things. And that one's a much more textbook heavy approach in learning, because there's a lot of electrophysiologic education to be had for that. And both understanding what pathologies, and a lot of this is still, you've already laid the foundation being a physical therapist, understanding your standard peripheral nervous system, central nervous system, and the pathophysiology that might be there. And then jumping into the training, it's a lot more in-depth education on that. And then how to use the machine that we have to complete the nerve conduction studies and the EMGs, based on then all this education that you have. So that one is more heavy on the coursework and a much more rigorous program. You go through the program that we are utilizing as a residency program through Hands-On Diagnostics based out of New York. And that one's actually a board certification. So the ultrasound, the company that we use for the training, we get a fellowship. That's a certification through the company demonstrating how many hours essentially you've trained. We will work for the RMSK exam, which is a board certification. It's a multidisciplinary board certification. We'll do that probably next year. And then through the residency program, we'll work towards getting, California always likes to make things special. So we had to get the EMG certification, which is essentially the California version of a board certification for the electrodiagnostics. And then we'll get the ECS. Skye actually already has ECS, and I'll be sitting for that in February or March. And that's the APTA board certification for the electrodiagnostics. So that's a much lengthier process that I just finished last month.
Yeah. Congratulations.
Yeah.
Just in time for your child to be born. Now you'll have a little more time to be present there.
Absolutely. And then I get to start studying.
Yeah. So are these board certifications in MSK and ECS or electrodiagnostics? Talk to us a little bit. Are these necessary for like some of the mechanics? Are these necessary for providing a diagnosis for insurance coding or for billing certain codes and getting reimbursed, or like what is that, completing those board certifications? Could you do it? Could you do this once you're adequately trained without them? And what are the differences in practice once you've achieved those, beyond, of course, being more confident in your ability to come to the proper diagnosis and all that, from a business mechanics perspective?
Yeah.
What is that dynamic?
And of course, obviously, the more trained you are, the more accurate and confident you are in your diagnosis, and that's why we do this. And so I'll give an answer to this. Skye might have a little bit more insight than I do, but with ultrasound, as far as I understand it, actually coming out of grad school with your DPT, it's something you can actually do without necessarily having any special certification or board certification. For the electrodiagnosis, it's much more protected in a way. So even all the studies that we've completed during the residency program and all that, that's all through a mentored process. And so there's only a portion of what the test is, well, let's say, valued at in a business sense, that we can even bill for until you have your board certification. So you're billing for the technical component of the test because you are technically doing the test and creating the data. And then although we create the report and the interpretation, since that's going through a mentor or essentially another board certified specialist, we're not able to bill for the professional component of the exam. And so now that Skye has his ECS, we are working towards getting our lab accreditation as a company in a clinic. And then that will allow us to fully utilize the testing services in a billing sense. Anything that you would add to that?
Yeah, I think Malachi covered the ultrasound well. We have found that payers do want to see a level of proficiency. So I will say the academic rigors that he described in the fellowship program for musculoskeletal ultrasound has been more helpful than I would originally thought, in just allowing payers to pay us through their channels. And then, what he said with the nerve conduction studies and EMGs, the reality is it's just a new thing completely. So without the academic piece, you wouldn't have a clue what you're doing. I'm sure there's those out there that are doing it, but it won't be here. But by pursuing, I'm trying to simplify, by going through the residency and the board path, you basically are opening up a section of coding that isn't available as just a standard clinical physical therapist. You have to have that skill set to be able to do those things. And as he said, at a lesser or more component as you get through that system of training or that board certification process. And so our goal is to create a clinician a year with that level of training. But again, it takes time. And so again, the value's there. And I think in Southern California, we're looking for those services that are higher valued. And this is one of them, or two of them.
That's awesome. And so you're opening up, new opportunities for different, whole new section of coding, as you said, and opportunities for providing higher value, higher reimbursed services. Are you billing insurance, getting insurance reimbursement for both? Or I remember hearing you say you do, at least some of the MSK ultrasound you do as a cash service. Can you talk about how you're handling that, the diagnostics financially?
So I would say it's the same with both components of diagnostics. Is insurance still wants to sometimes lump you in as just physical therapy, which I hate to say that out loud. But again, from a reimbursement perspective, that's often below what you expect to get reimbursed as a clinician providing physical therapy services. So then when they want to throw ultrasound or electrodiagnostics under that same umbrella, that's just not going to fly. So we've done, created another diagnostics company and funneling those contracts through that. So that's a process, right? We all know how quickly those things can go. They're very slow. But in the short term, to be able to provide these services to our community, offering it at a fair cash price, which is a win-win for both, right? So it's a win for the community because you're offering a service, hopefully more quickly than the healthcare system can allot for. Maybe it takes months for you to get in for one of these tests at a standard healthcare loop, where we can provide it the same week most of the time. And so then a win for us because we're getting reimbursement at a higher level, and a win for the patient because they're getting it at a lesser level than they would pay typically if they were to have to pay full price somewhere. So again, it's a win-win scenario that we're trying to build our cash program on, which is part of the NeuFit journey for us as well. So, but it's worked really well. And I think as we get more advanced at handling the contracts, we'll probably see more insurance. But again, we don't want to be building on the foundation that a lot of clinical practices, including this one, have been on, where the insurance kind of dictates the value as opposed to the clinician being able to ask a certain value.
Thank you so much for listening to the Undercurrent podcast. If you're interested in learning more about how NeuFit and the Neubie can impact your life, please visit our website at www.neu.fit, that's neu.fit, so you can learn more about how it might integrate into your professional practice, how you can use it as a patient, and you can also connect with our team there.
Yeah, the market can dictate the value.
Right.
Doesn't have to.
Instead of,
Yeah.
well, again, insurance.
That's good. Yeah, very, very well said. I think that's very clear, and people will understand this, what the opportunities this can open up insurance wise, and also, direct pay cash wise. So Julia, let's come over to you. So it was interesting to hear Skye say that he wants to create one new diagnostician per year. I love that. So
yeah, it's a goal.
That's great. So Julia became the most recent. Are you the most recent diagnostician?
Yes, yeah, I would say that. I just started in June the process for ultrasound. So I've just finished up those initial trainings, and I'm about, I would say, a third there in terms of studies. So
nice, very good. And in the meantime, you've been before taking this on and doing more diagnostics, you've been primarily treating, and you've been, as I understand it, really the Neubie champion there as well.
Mm-hmm. Yeah. So I don't know if I quite knew what I was getting myself into either, but I said yes, and we figured it out as just kind of rolled with the punches, and I would say we're really successful actually because of the tech aid team that we have right now. I think initially, once we started, we just wanted to learn how to use it best, and once we kind of established those loops and delegated to them, always with having a good critical thinking behind why we're doing everything, we've seen that be more successful than ever lately.
Meaning having your tech and aid team implementing, some of those Neubie sessions and, leading patients. Okay.
Yeah. So once we kind of delegate the plan of care or appropriate setups, they're primarily the ones completing the setups, even having the conversation with the patient just regarding how they're doing. We have some really high level techs that are really good learners, and they've been able to help us learn how to use it better, and in turn, if we just listen to each other and learn in that sense.
Awesome. Does it matter? So one sort of procedural question before we get into some of the interesting clinical details of implementation, but like if you were treating a Medicare patient, for example, do you still have the tech or aid, or does that have to be a physical therapist implementing the Neubie, or what does that strategy does that vary, or can that be done consistently? I know there's different,
Right.
compliance things around that. So can you just talk about that procedurally for a moment?
Yeah, to my knowledge, being that it's a cash pay service that we only charge for the Neubie cash pay, we're just providing it as a service. So, that doesn't matter the insurance payer there.
That's right. And if it's not done by a physical therapist, obviously it's not physical therapy. So,
Yeah. Right. And we try to always have a physical therapist that, does the initial consult and decides what the plan of care and makes adjustments accordingly, just, for liability wise and making sure our patients get the best care that they deserve.
okay. So this is um, interesting here. So can you talk through, Julia, an example of a patient who, from your shoes. So so let's say even, a few months ago, before you started on this diagnostics journey yourself. So when you just had your treating hat on and you weren't doing these, I mean, you're still assessing, diagnosing, but not doing the MSK ultrasound or not doing the electrodiagnostics. So before that, can you talk through just a good example success story of an NCEPT patient who comes in, does some diagnostics, whether it be ultrasound or electrodiagnostics with Malachi or with Skye, and then comes to you for treatment. Can you just talk us through step by step what that patient, their complaint when they came in, the diagnostic process, what was relayed to you, and then what you did with them, and then what you told the tech who may have done some of this? Can you just like literally walk us through step by step how a patient, pick a good example success story, but how a patient goes through the NCEPT process?
Yeah. Great question, because we have so many success stories. But let's say as the therapist does their initial evaluation, we try to always have the conversation regarding diagnostics as appropriate. So we screen for certain symptoms that we know to be helpful and or applicable to diagnostics. So my best example would be when patients are complaining of numbness and tingling, let's say just down their bilateral lower extremity. Maybe there's a history of back pain there. And so we ask some more follow-up questions and then refer that person for an EMG. And for us, we need that signature, of course, to get authorization, all that good stuff to do the EMG. And we try to have that conversation.
Meaning from a physician?
Yes.
Okay.
So when we're utilizing insurance, we need an MD to sign off on that study. And in our case, we'll try to have a conversation with the diagnostician before they do the study. Sometimes, I would say more than likely, we get to see that test done early on, which allows us to make better decisions regarding care and treatment early on, which allow for better outcomes more quickly.
And when you say the diagnostician, is that Malachi or Skye? We're doing that in-house at NCEPT, right?
Yes.
Okay. Yes.
And we can get someone in the same week, or if not, rarely same day. But if we get that opportunity with an ultrasound, we'll throw it on during the eval, and that's always a really good visit for that patient when they get an answer the day of. But from that process, once the diagnostic visit is completed, the therapist and the diagnostician get to have a conversation about what they found. Our diagnosticians also really explain to the patient what's occurring and what they're seeing, which is a distinct difference between if you go to a neurologist and they do their tests, they don't usually say much, and then the report is created and then given to the patient, and not always the message is not always relayed. So what we love to do is spend the time and sit down with them and explain what this even means, and then how is that going to change treatment. So that's kind of been one of the best things I get to do, is just spend time and explain, like, why did we do this? We are always explain before we do it, why are we even doing this test? Why is it valuable? But then how does this change what we're doing? So in this case, I'll use example of a radiculopathy that was found on EMG. And then part of one of the studies that's still going on for NeuFit is we have those specific patterns that we get applied pads on, and we've well educated our aides and techs kind of, this is the appropriate patterns. Then what's great is we also get to have that conversation with them and educate them on what is a radiculopathy, why are we putting these pads there, which rarely any of them will ever be exposed to. So just a great learning opportunity there. And then we have, again, most of the therapists will make sure we are checking in with the patients those initial few Neubie visits, as long as the placement is correct and we're evaluating that there's a change occurring there, which is not always as quick, depending on an acute or chronic condition. But yeah, we just spend a lot of time educating on them, all the expectations, and then what I love to do is just explain other success stories, because there are, anytime we listen to a podcast of yours, or just there's a lot of good stories out there of the success of the Neubie and sharing how research-based you guys are. We even give the patients printouts of some of the studies. So it's just a really great point of education. We've even gotten the opportunity to, send those in with our patients when they go see their doctor and spread the word that way. Because, everyone should be learning just the benefits of obviously diagnostics, but most importantly, NeuFit.
Awesome. So one of the things that Julia just mentioned was radiculopathy study and pad placements. And so just for reference for you listening to this, we're currently just completed, have been in this data collection phase for the radiculopathy study, which is essentially a follow-up study to the diabetic neuropathy study that we've shared on the podcast before, and many of you know about. We talked about it a lot in depth. I believe episode 99, we covered that, and plus or minus somewhere around there, but maybe 98, 99. And so this study, the radiculopathy study, is similar in that we're using EMG diagnostics to evaluate objectively nerve activity beforehand, and then doing an intervention with the Neubie with electrical stimulation, comparing alternating current and direct current again, actually also, and then doing functional tests and EMG afterwards to get get subjective and objective and functional pre and post assessments there. And the everything is still in the process actually right now of being analyzed and written up. But so far, I'm told by our PhD professor that the data is showing positive improvements with the Neubie. So in this case, Julia, if you're thinking of a particular patient, has this radiculopathy patient, improved, or how's it been going, either with the patient you had in mind or multiple, if you've seen many of them?
Yeah, I would say we've seen many positive improvements, and even same day change in symptoms, which that's what everyone wants, really, is that quick change. But being able to explain to them it's nerves are some of the slower healing tissues in our body, so having the appropriate expectations as well.
Yeah, that's good. So that's one really good use case there. Someone comes in, like you said, bilateral numbness, lower extremity. I think you said after some sort of back injury, and you're able to diagnose using the electrodiagnostics, diagnose this as a radiculopathy. Can you, and I'd like to go around the room and give everyone a chance to share one or two. Can you give us just more examples? Like you said, Julie, I think the stories are super valuable. Give us an example where you were able to find something, get some sort of clear confidence around a diagnosis, doing either electrodiagnostics or MSK ultrasound, and then treat, and then perhaps measure changes afterwards. But can you just sort of walk us through some more use cases and examples of successes that really give people a sense of how you're able to work with patients throughout that entire continuum of care, diagnosis through treatment?
Yeah, I have one that really sticks out to me, and actually, now that I think about this, is probably just a case study I need to likely share with you, Garrett. So a patient came in with an injury to the shoulder. She had surgery. She had a fall, fractured her shoulder, and then had surgery afterwards, and of course had the shoulder pain and immobility of the shoulder after the fracture before surgery. But after surgery, then developed a significant amount of neurogenic symptoms down the left arm. And she's been probably my biggest success story so far. So I first met her from getting a referral for a nerve study. So she was an external referral. I hadn't met her before. She came in the doors to get a nerve study from her second ortho that she was working with after her shoulder surgery, which had developed all of her neurogenic symptoms: numbness, tingling, paresthesias, lack of sensation, radiating pain from her shoulder all the way down to her hand, and up into the neck, and then essentially minimal to any motor activation of her entire left upper extremity. And just miserable pain. So it was not a fun day when I first met her. I was absolutely feeling for her. So we got through the nerve study. She went through that well. We found a brachial plexus injury. If I'm remembering correctly off the top of my head, it was lateral cord of the brachial plexus. More so affecting the lateral portion of the arm. Anyway, we could dig into the specific findings, but found some very clear and severe nerve damage to the brachial plexus, and also was able to clarify that it was not up at her neck, which she also had symptoms up at her neck. So was able to localize the lesion of the nerve to the shoulder, which could then relate to shoulder surgery. Not that I can necessarily say that, but based on timing and stuff, you can presume. So I told her about the Neubie, and I was like, hey, you're in a lot of pain. We have the Neubie. It's something that we can utilize to help treat nerve pain and try to help kickstart some nerve healing processes. And I was like, you're in so much pain. Just let's go try it right now. Like, no need to wait. Let's go try it. And she was up for it. And first couple of visits, didn't see a huge change, but she was pretty motivated to do anything to help because she was pretty miserable. And within a month, she had of 1 to 2 times a week, depending on what her schedule was, coming in. And I was essentially I kind of did the setup that we do for a positive radiculopathy nerve study. So I went to the site of the nerve lesion as close as I could get. So I went just above, kind of at all the nerve roots and where they turn into the brachial plexus, kind of the top anterior portion of the shoulder. And then I went to 2 different muscles. Actually, I went to one positive finding muscle, her bicep, and then another area where she had a lot of symptoms. And so surrounded the nerve lesion and nerve symptom area. So it's, again, essentially kind of what we do for radiculopathies. And within a month, her symptoms had dropped dramatically. She still had pain and numbness, tingling, but significantly less. Starting to get muscle activation through her arm, could start to lift her arm again. So that was kind of within 1 month. We had a break in care due to insurance and waiting for blah, blah, blah. And I think she had a vacation in there too. And so started up treatment again, both Neubie, physical therapy, and ended up getting to do a follow-up nerve study with her because she's seeing a new doctor who wanted to know if she also had carpal tunnel. And so tested again, and just within the details of our first nerve study, it was the brachial plexus injury was enough where you actually couldn't, for the most part, couldn't fully see if there was or was not a carpal tunnel syndrome at the same time. So on her second study, I actually found a lot less of the original nerve injury. It was still there, but a lot of the acute findings were gone that we see with EMG abnormalities, and a lot of the nerve conduction studies were improved. I had larger amplitudes, faster nerve responses on our second study, along with I did actually find a mild carpal tunnel, but that's here nor there for this patient scenario. So some of that being tied to over a month of time, nerves healing. And, but I mean, she had had her symptoms for about 3 months, if I remember correctly, before I ever met her. And then as we started the Neubie, within a month or so, she had significant improvements, did the follow-up study, found improvements on her EMG and NCV results as well, along with symptoms improving drastically. And now we've been continuing to treat her. She developed contractures in her hand and maybe some adhesive capsulitis in her shoulder from lack of use. So now we're dealing with that. But nerve symptoms are almost essentially gone. We've actually, for the most part, wrapped up using the Neubie because she has no nerve symptoms anymore. Mostly the contractures and the limited joint mobility that we're working on now. So she's been an amazing case study in my mind for what we would label as severe nerve damage in the brachial plexus.
Awesome. Perhaps we can talk about some strategies for adhesive capsulitis and some other applications there too.
Yes.
But that's great. Yeah, that's great. So, Skye, how about you? Can you think of a success story and just kind of walk us through diagnostics, through treatment, just so people can sort of see the NCEPT model in action?
Yeah, I think for me, I'm again the old dog learning new tricks, and so I think of two different perspectives. The patient perspective, since I'm not treating on the floor as much, I definitely don't have as many specific treatment ones, but I do see a lot. And so again, a lot of the people I've gotten to know over the last 10 to 20 years, I see them on the Neubie, and oftentimes there's this sense of excitement because, again, I think one thing we try to do is provide hope here. And so one thing the Neubies allowed us to do that we couldn't do before it, definitely not as effectively, is provide a tangible short-term relief, like Jules was saying, when you can get that in just one treatment and there's a palatable change from when you walked in to when you leave. And then two, especially with the neuropathy, giving an option, right? Oftentimes some of the more difficult peripheral neuropathy patients with peripheral neuropathy, they've been around the medical horn. I mean, they've tried a lot of different things, and to have an option with the Neubie has been great because you can see them usually set up in a foot bath or something like that, and being able to talk through that. And again, getting that relief is huge. And so I think from just a value perspective, from a clinical perspective, I guess, that's been great because I get to see that more from afar since I'm not on the floor anymore. But then number two, maybe I'll put my business hat on a little bit, is Jules and I talked about this, and Malachi and I, is creating an opportunity for clinicians to get comfortable with a cash narrative, because we do offer it as a cash service. We kind of took insurance out completely on this one. And the gradient of being able to offer that to patients who maybe can't necessarily or afford a cash physical therapy visit, well, they have a Neubie option, right? So that it's a lesser gradient. Or maybe a diagnostic conversation is pretty scary for our front office or a physical therapist to be offering a service that can cost several $100s, and yet they can offer the NeuFit as something that's much more economically feasible for them to get relief with. And so that's been kind of a secondary benefit that I don't know if we originally were thinking that, but allows a gradient of treatment and approaches that we can offer. So that's been a cool thing.
That's awesome. Are you willing to share a little bit about your model and what that offer looks like to other practice owners around the country or around the world in terms of what does that look like?
Jules probably knows all the specifics more than me, but the reality is we offer it how much for $30 for a service or for a single session, or they can buy a package of 6, I think, or 7. I can't remember the exact, and that would probably give them $5 off per session or something like that. Whereas compared to our physical therapy services, it's $150 for a cash visit, maybe a little less if you do it as a package. Whereas our ultrasounds will be $150 to $200, and then you have your EMGs, which would be closer to $500. And so again, you have that gradient of services that we can offer to our community.
And that can be an add-on during a PT session or before or after a PT session, or it can be something separate where someone might come in.
I think it often is an add-on. I would say probably more often an add-on. And then there are those that maybe they're done with their physical therapy, or they come in at a different time to get additional Neubie sessions.
And at that price point, like Julia said, those are going to be with a tech or an aid, or it's going to be a foot bath where it's not requiring as much of your team's time. at that price point, right?
And again, kind of piggybacking on that, yeah. So the tech or the aide will often set that up. We actually have a NeuFit schedule, like a Neubie schedule, on our calendar, so that we know when we need to be having those setups. And I think Jules kind of hit it. The clinician will often have already worked through what it needs to be, and then having your techs trained at a levels to where they can do that for that patient. I think that's typically how it goes. But I think, again, we kind of, I'll just spend about a minute on this, is being very intentional about offering valuable opportunities to techs. You talked about it in the recruiting model with Jules and Malachi here, but at the same time, I really want young college students or even high school students in some cases to have an opportunity to see what physical therapy is before they go invest a large amount of money in their graduate degree, right? We all think we want to do things, but they really need to be comfortable. Do they like interacting with lots of people with lots of different ailments and different stories and different conditions, and how it can be in the clinical environment and a lot of team members around them. And so giving them an opportunity, not just to volunteer, but to earn a wage and be a part of a team. And then as we've gotten better as clinicians and team members, now training that so that they're actually a part of the team that's bringing these services to our community. And it's been really fun to see, and giving them a purpose bigger than, bringing patients back and all that kind of stuff. And they've definitely become a huge part of that, because that helps the clinician be successful, right? They take care of a lot of that extra time work, but it often makes the patient experience that much better if they can do it confidently.
I love that. That's beautifully said. Just to get a sense of your practice. So obviously we're talking to the three of you. You talk about techs. How many NCEPT team members are in the office on a busy day? How therapists and techs, and give us a sense of.
I kind of give the owner speech, like the 60-second owner elevator pitch. Like, we roughly have anywhere from 425 to 460 visits a week for patients. We have 8 clinicians, plus or minus 1, depending. Usually a student, maybe 2, but we'll usually have about 3 students a year on average. Tech team, we try to have, I think, 1 tech for every 2 PTs that are working, and that ratio shifts. And then another bunch of front office and admin staff to help us get them scheduled and taking care of all the other logistical needs that come up. So, and then we have a pool, so about 6,000 square foot facility that we fit all that into.
Yeah, that's awesome. Yeah, it's a serious operation there, and I'm excited to actually get there later this year and come see it in person. I'm going to be at a conference. In terms of training your techs, I don't believe we've talked about this yet, so I guess I hope I know what the answer is. But are they going through our NeuFit video training, or are you? What's sort of the extent of how you train them so they're comfortable providing services, and how do you get them up and running and confident with the Neubie?
Yeah, so our lead tech, we spent a lot of time. I think about the time we were starting to implement the Neubie, she was pretty new on the team too. And so the more that time was a lot more therapist heavy using it. And then once we've found our stride and, typical successful setups, we've put it on paper. We've also, we do a weekly meeting or monthly meeting with all clinicians and the aides that are there to just kind of refresh our memory on things, ask questions, talk about wins. And then I think we do about a bi-yearly training of all the techs, and that includes the Neubie as well. And then we do record all the monthly meetings, and we had other various videos so that everyone has a standard of what it should be. But yeah, we do a lot of hands-on, as they get hired on as well.
Awesome. Well, you guys are really running a wonderful practice there, and I know people listening are going to be able to grab one or many pieces of inspiration and ideas for implementation. So I like it. As we wind down here, is there anything more beyond what we've talked about that you would like people to know about NCEPT, about your practice?
I
do. Yeah, go for it, Malachi.
Well, and I think it's kind of an accumulation of all the things we've talked about today. This is obviously the NeuFit podcast, but you've asked us a lot of questions about how we've implemented diagnostics, and I would say what we've attempted to do is build the most efficient or the best efficacy of treatment that we can provide for our patients. And so we're picking and choosing the best things, right? We're not utilizing ultrasound treatment modality as a heating module anymore because evidence isn't supporting that, and XYZ and insurance isn't paid for, whatever it might be. So we're really handpicking the best services that we find that we can help our patients with. And so that, of course, we all believe in PT. We're PTs here. And being that is one of the best things that we can do for a majority of patients, not that we can fix all things. And then implementing the diagnostic services on top of that. Now we have a much greater detail and a much more accurate assessment of what's going on. We can treat a lot of these things with our PT training. That's what we were trained to do. But with the musculoskeletal ultrasound and with the electrodiagnostics, we have so much more information so readily available and so quickly communicated and efficiently communicated both to the patient and the treating clinician that provides a much deeper level of pinpoint accuracy on per patient and per patient scenario, and monitoring patient progress as we go too. And now utilizing the NeuFit, again, the next kind of big thing that we have bought into and believe in is the true effect that we can have on the peripheral, the nervous system and how it works, and going into the physics of that, the direct current and how the nerves work. And now we can actually create communication through that nervous system and actually stimulate communication pathways and generate or kickstart some of the nerve healing processes. And to us and to me, I would say it's really just creating the best efficacy possible for our patients. And that's where we're dedicating our time. And that's what you're now asking us about. And I would say we're getting better at it every day. Of course, there's fumbles here and there. We're always learning. We're human, but I would say every day we're getting better at all of those factors. And our patients are telling us that's true, and we keep finding it to be true. So we're going to keep moving that direction.
Awesome. Skye, were you going to say something also there?
He says it in more words than I do, but I mean, I think of our purpose statement to bring the light to the community by helping its members revive and thrive. And so he kind of hit it with the different tools that we've integrated into our treatment model. But if you can pair light to truth or hope, all the things that light can mean in the world, like we're basically trying to provide those things for our community. And so the things we want to put in our tool belt and the skills that we want to get good at are the things that will help us do that better so that our patients can revive and thrive. And so we often get hung up on the revive piece. Like we really want to just get them back to what we would call normal. I think, unfortunately, that's maybe where healthcare is. But I'd like to add that word thrive. We don't only want you to get back, we want you to be better than you were. And I think, again, through the team dynamics and the culture, we're trying to do that internally. But the reality is by the tools and the skills that we're trying to breed into our clinicians is to hopefully provide that for our patients and our community at large.
I love that. And it's working. I see all three of you as bright lights and love what you're doing. So I really appreciate you coming on, sharing your behind the scenes look at NCEPT and the team and how you guys are doing things. So that's very good. What as we wind down here, I've got one final question. Before that, what's the best place for people to look you up? Is it the NCEPT.com website, social media platforms? If people want to see the practice a little more, how you're doing, or they're in the San Diego, Escondido area and want to go in and see you, what's the best way to check you out?
Yeah, so the website, like you said, NCEPT.com. I think we're on most of the major social media, Facebook and Instagram and those types of things. Or reach out to us more. So you could email us. But I would say that's where I would start, and that would give you our contact information. And again, always looking for people that are trying to raise the bar, not just for our profession, but for the communities at large. So, yeah.
Awesome. So I've one final question I've been asking on recent episodes, and one or two or three of you can answer. So the question is, if you could shout one message from a mountaintop for everyone to hear, or place one message on a billboard for everyone to see, what would that message be?
I'm going to let Jules go first.
Oh.
I already know what I'm going to say. I'll say it. She's thinking. I'll say the best is yet to come. The best is yet to come.
I would say just make the most of every opportunity that comes your way.
I like that.
All right.
I guess I'll say get better every day.
There we go. Well, the best is yet to come when you get better every day by making the most of each opportunity. So. I love it. I love it. Well, I just really appreciate the three of you. It's been a real pleasure and honor getting to know you and learning more about your practice, and getting to connect with you at events. And I really appreciate you coming on and giving everyone in NeuFit Nation this behind the scenes look at what you guys are doing, because it's very special. And as I said, I know it will inspire people, whether it's bringing on diagnostics or doing something in the team dynamics or framing up how they do something internally, procedurally, whatever it might be, but or even just a little bit of inspiration to get through a tough time and know that there is a role model out there to strive and be like, and whatever it might be. So I really appreciate all three of you doing this, taking time right at the end of your clinic day here. And Malachi, best of luck to you and your wife for a safe and successful delivery with new baby on the way. Very exciting. And
Thank you.
I really appreciate all three of you.
Yeah. Thank you, Garrett.
Thank you, Garrett.
All right. And thank you, NeuFit Nation, for tuning in to this episode. We will see you on the next one of the Undercurrent Podcast.